When I was asked in 1994 whether we would open a medical school, I said no, medical schools are too expensive, and there are enough medical schools in the Philippines. But finally we agreed that we would build a school of medicine and public health. Why did we agree? Because unfortunately, some of the major obstacles to health for the poor are the doctors. Unfortunately, they are so aligned with the pharmaceuticals and the others, they actually buy a lot of generic medicines and so forth. We're sad about that, but it is a problem. And so we felt that if we could educate a generation of doctors who would really support health care for the majority, that's a contribution that we want to make. Governance, governance, we work with I told you the framework is local governments. We have this Ateneo School of Local Governments, and it is within that framework that we carry out almost all of these things. And finally, I think social entrepreneurship. Thank you very much.
Thank you very much, Father Ben. We now would like to request Father Ben to sit in the middle for any questions for the open forum.
George, in Central University, I'm interested in the doctor's education because you said that you have a special education to let them care for the poor. What do you do in this field?
So the curriculum for them, so for example, the summer before they begin medical school, if they have not already have experiences in working with poor communities, we ask them to spend the summer there, so that when they come into the medical school, they will understand why we not only teach them anatomy or physiology, why we ask them, why we have modules on community health. The way it is phrased is that the typical medical curriculum focuses on the care of the individual. It does not focus on the care of the community, like safe drinking water or sanitation. So the program therefore attends to aside from the care of the individual, it has modules on what is the role of the community in healthcare, and how do you as a doctor, what's your role as a doctor in that care of the community. We also offer management because we realize that they need management skills. So so I can tell you more about that. So there are modules in finance, in marketing, in other things, but focus precisely on different levels. You could be at hospital level, rural clinic level, or community level. How do you manage healthcare for a community? How do you manage healthcare? What are the financials of healthcare? So the skill health will be part of it. So it's a bit of a complicated module, and it's very, very challenging because within a particular course, they would have to blend many of these things. So, just for example, is that for the pediatrics, they not only go to a hospital, but we give them to the poor public schools where we work, and we ask them to do precisely analysis of the status of the health of the children in these places. And they help us in the public schools, but they also begin to understand what child care means at that level.
Greg Alford from University of Detroit University. Father, I'm interested in the balance between the political process of the leaderships of towns and communities and the educational process that the institution is doing. Would you comment on that?
Can you get it a bit okay?
Yes, on the political process of the election of officials and the people who run the towns and cities versus the educational process that you hope to deliver to individuals that are in those communities.
Well, first of course, they have to win the elections. We have that. So, at the medium and the long term, in the program that we run, whether the full Masters in Public Management or shorter modules, we engage not only the elected officials already, but councillors and others who are typically likely to be the next ones to engage them. we actually even have a module quite popular together under our foundation on how to win an election. We run that very popular bestseller in the bookstores, and it's divided into two parts. First part is of course the ethics and ethical part, things you value about. But the second part is done by key people who have run election campaigns, media people, marketing people who basically tell you how to market yourself. So it's a second very pragmatic part, and we do both. So it's a balancing on the one hand the values and the pragmatics of winning an election, and learning from it. For example, in the last election, there are many lessons learned about the balance maybe not being so good. In some cases, the mayors that we worked with were perfect on the what they call transformational side, but did not spend enough time on the groundwork and lost. So lessons learned also on how do you balance besides the ideals, and also people say, yeah, but what's going to be for me? These are lessons learned that we try to pass on and try to make sure that people understand the balance. And then the educational part, we pass it on because we have elections every 3 years from there. So to help them to be sure that the two ones stay in the elected office. But they learn a lot from each other. That's one of the things we find out. We also find out that some of the best lessons are among themselves.
Please.
I'm Benny from India, St. Joseph's College. I was glad you made a reference to Amartya Sen about the parameters towards development, health, education, and access to a job or income. Probably access to education gives you access to a better career or income. Maybe I would like to know how affordable is quality education in the Philippines?
Of course, by international standards, we're very cheap. It costs about $2,500 a year to come to this school, which is very cheap by American standards. Quite expensive by Philippine standards. And that's why we find that a strategy of trying to bring scholarship, we have 15% of our students have a scholarship, about 1,100 students here are scholarship. But that's not going to solve the problem. And that's why our commitment is to work with a large-scale public school system. There are 20 million children in the public school system, about 16 million about 15 million in elementary schools and 5 million in high schools. And that's why our effort is not to bring people here. We could, but it will not make a dent on the poverty problem. Our effort precisely is to work with the national and the local governments to upgrade the levels of the public schools. We feel it's the only way to really achieve the scale. So we devote quite a lot of our effort and resources to that area.
About convening in Mexico City this last March at the Jesuit colleges and universities. And what do you see as the potential of the Jesuit colleges and universities as a network in addressing some of the challenges beyond the role of individual universities, to sort of the network effect and possibilities? Have you thought about that?
Yeah, I was quite happy with many of the results in the Mexico conference. The themes that we had, social entrepreneurship was a big concern. The whole area also, this cognitive capability that I'm describing here was a key concern. I think that the challenge is a little bit like what Dr. Sudero said, like the house. And the question really would be how do you do it? Like for example, for us, how do we actually engage the health institutions? How do we actually engage the health institutions? Means the national institution that provides the insurance, but it cascades all the way down to the mayor. The mayors are very, very key in implementing it, and so we can share with you how it works here, but it might not work the same way in other countries, and we could learn from one another. So what we find is that looking back to the 1970s, we tended to think very often at the top or the bottom. We tended to do that. We tended to look at the very poor, and we tended to look at the national government. We learned that they're too far away from each other. And we have to work with what we call mediating institutions. The institutions that are nearer and where the feedback loop is clearer. And this is why we have learned gradually that it is the local government, for us in the Philippines, the local government is the key. So, for example, in all the things I've talked about, whether it's building homes for the poor, Kawat Kalinga, or whether it is health, or whether it's education, we find that the mayor is key. Where we have the greatest successes are really where the mayor is on board, and we can work with them. One, because they can rally the community around the projects. Two, because they can focus the resources to these very key projects. And although they may not have all the money, they might need it from the national government, they provide the seed money and eventually get the national government or locals to contribute. But at least for us in the Philippines, that's what we have found to be the key, the center for a lot of reform. It may be different in other countries, and we can share. Maybe one last point about here. For us also at the Ateneo de Manila, it's both a privilege and a responsibility that so many of the leaders at all levels in this country come from this university. It can be good, it can be bad. We have to be responsible also for all the problems we have. But it also allows us to precisely move forward if we can bring them in. So we are now completing the list of all the officials, both elected officials at all levels and appointed officials, and we invite them to a big mass and talk to them. That will be sometime probably around the Feast of St. Ignatius at the end of the month. And we'd like to do that and engage them. And we hope that more and more of them will become partners in this development.
Well, thank you, Father Ben. We'd like you to stay on because Dr. Greg Alfords, Dr. Michael Lee, and Dean Julian would like to present a token of appreciation.
Go ahead and see what